a non-judgmental state of heightened or complete awareness of one's thoughts, emotions, or experiences on a moment-to-moment basis. So, what does that mean exactly? Mindfulness in itself is a way of being present in the present moment. Many times, and I see this as I counsel patients, um, because of the condition that they have, this chronic condition, it is very hard to stay on the present moment. It is very hard to stay um, in touch with one's emotions and thoughts. So this is part of a problem that we have, I think, as a culture, and that we are very oriented in what happens in the past or the future. It's very hard for us, as our human nature, it is hard for us to stay on the present moment. And I say that because our mind is structured in a way that there's so many thoughts, there's so many emotions, there's so many thoughts in our mind, right, that happen all at once, and we have tasks to do. We have did I go ahead and did I make this payment, um, for the person that is struggling with anxiety, for example. There's a lot of catastrophizing that they have. A person that is undergoing a great deal of distress, so they might be thinking, oh, would my spouse leave me? Would my spouse think that I'm gonna give him the HIV virus, or just if even though we use a condom. So all these thoughts and not this rapid fire, it's something that it's very common for people, mostly for people that are living with HIV. So this is something that I've seen and I consider you see, and I help clients to be able to be mindful about their present experience. Alongside with that, we have acceptance, what is mindfulness and acceptance, and they both go hand in hand. So acceptance can be defined as the voluntary adoption of an intentionally open, receptive, flexible, and non-judgmental posture with respect to moment-to-moment experience. I said before, it goes hand in hand to mindfulness. It's in itself being open. Now, when I say open and receptive and non-judgmental, what happens if you have a thought, oh man, that guy is the worst human being I've ever seen in my life? And let's say that thought just came into your mind as it came into a patient of mine. And you say, man, why do I think that thought? Like, what's wrong with me? Why is it that I'm always thinking this negative thoughts? So this person already has this constant battle, this inner fight that is having, oh, it's already judging oneself upon a thought that they had. What happens with our thoughts is that our mind works in a way that thoughts just come without, they don't really, our thoughts come without asking permission. So if we're able to non-judgmentally accept the thought that is coming in to our experience as is happening in the current moment, it is likely for us to be more mindful and accept what's going on in our lives. So I want to break it down. What is a private experience? A private experience that we're experiencing in the present moment contains many aspects. So we have thoughts. And I said before, when I say a thought that it has a connotation of negative, right? A client comes in and says, there's something wrong with me. No one will love me. Man, I'm so lonely. Life is not worth living. So they take this thought and they buy into this thought. They think this thought is reality. When we're going to talk about later on is diffusion, cognitive diffusion. When you take a thought, which is the cognitive part of our being, and you're fused to it. So you believe this thought as is the only thing that matters in life. So it's important that the non-judgmental posture that we're going to have. It's important to understand that a thought is just a thought. I have fear here, but that's an emotion, so that was on me. But you understand that thoughts are just part of our experience, and they are to be accepted as they come and as they are going to be coming, because they won't stop coming. We also have emotions. I know that this is something that they use for preschool kids maybe, but I like this image. So they put this is how I feel today. This is how we teach. I think sometimes it happens that when we're younger, we are more in touch with what's going on in a private experience. You ask a kid, and then the kid can say, I'm sad, I'm frustrated. But there's a disconnect that happens when we become older, that, we have more pressure from our jobs, we have more pressure from our culture too, and then we feel that, hey, I'm not regarded, I cannot express my emotions, or I cannot, my emotions need to, if there is something that I'm mad, I cannot show that because, they're not going to like it if I show that I'm mad. So it's important for us to understand that emotions are just part of our private experience. If we do not judge our emotions and we see them as they come, we are going to develop what is called psychological flexibility, which is part of what mindfulness does. It helps us to become more psychologically flexible. And that's just part of us being more healthy. So when I say mindfulness and its role in mental health wellness is to become psychologically flexible. Now, so the flexibility is flexibility and rigidity. And I'm going to have a slide on that, and I'll explain a little more into that. Now, another component of our private experience are bodily sensations. So the point of this is to be aware of what's going on in our body. So that's what mindfulness is all about, right? We're going into this, and we're learning that what's happening in our current moment is very important. So you can feel your shoulders are tight. You can have lightness. You can feel heavy. You can feel relaxed, or you can feel flushed. I don't know if you ever got caught up in a traffic light, and this car came from out of the nowhere, and you felt that flush, that adrenaline soaring into your body. And what can a lot of us do? We go ahead and we call them rage, and the traffic rage drivers. But that's a normal experience. So if we're mindful at that moment as that happens, what happens when a client goes for the first time into their first HIV medical appointment? I have been myself part of that experience for the client, and I can attest that that is one of the most anxiety-producing experiences that a person can have. You don't know what's going to happen. Well, let's even go before that. Let's go from the person when the person is diagnosed with HIV. I don't know if I have any test counselors in here with me. You can attest that if you are good at sensing people's nonverbals and understanding what's going on at the current moment, if that person is able to express that, there's a lot of anxiety. In my experience has been a lot of anxiety. A lot of so what comes with anxiety? You feel flushed, you feel warm, you feel constricted, heavy. So this is all happening in your body. So if the client, or you can have a rapid heartbeat, a client that is having a panic attack. I have clients have panic attacks in my room, in my conference room when I'm doing a client session. And actually, the topic that I'm going to discuss later on in part 2, which is a case study, it's a client that has had a panic disorder. And this is something that it was very enlightening to me to see that person experience that, having that experience, and able to see through mindfulness how that person was able to come to the present moment, to not judge that rapid heartbeat, to not judge that flushed feeling that you feel that you're going to pass out. So that's important for us to be aware of. Now, we have memories and images. It's another part of our private experience. Now, this is where it gets tricky, because a person that has experienced a trauma, I have clients that have experienced trauma in their life, HIV related and non-HIV related. So what happens is, if they get maybe the picture, an image from their their abuser, that they're going to want to go ahead and block that image. I can't think about that. I can think about that. That's too painful to memorize. That's too painful to relive. So I know it's hard. It's easier said than done, and I've seen that firsthand. But a memory is, like I said, we are the ones that give that connotation to a memory. It's a good place to be, where the client, the patient, ourselves, we go from seeing a memory that we identified as negative, as a death of a family member. I have had that experience in my life, and sometimes I have flashbacks of that family member receiving the news of that family member dying, and I will have that flashback, that memory. It was like a movie, so it plays in you. So one way of dealing with that, the clients deal with that. Like I said, is what we call experiential avoidance. You avoid that image. You do not want anything to do with it. You said, no, that image is bad. I am judging it as a bad memory. Please get out of my mind. What's going to happen with that memory? What happens, do you know, a boomerang? A boomerang is you throw it, and it's going to come back at you. It's not going to just disappear in the forest. If you throw it, it's going to come back. It's the same thing, and that happens with memories, with bodily sensations, with thoughts, with emotions. If we avoid them, if we do not acceptance, non-judgmentally, and are mindful about them, they're going to keep on coming back. And every time they come back, they're going to come with greater force. So this is something that mindfulness does. Now let me know if what's my pace. Everybody can understand what I'm saying. Any questions so far? Remember, I'm big on having the participants kind of interact with me, and you'll see that later on. I'm going to ask for your participation. I hope that all of us can really participate. So any comments, any feedback so far? We're 15 minutes in. We're halfway through. Nobody yet? Okay. So Rachel Andrade says, I'm learning a lot so far. Thank you, Rachel. Appreciate you commenting on this chat. So, psychological process of ACT. ACT. What we're talking about here is ACT. What is ACT? It's acceptance and commitment therapy. Acceptance and commitment therapy is a treatment modality that I'm very fond of, and it was developed by psychologist Steve Hayes. Now, if you guys are in mental health, you understand that there's a second wave and a third wave behavioral therapies. So ACT is part of the third wave behavioral therapy. And what it does is just combines a lot of components of different things, and it looks at our experience as it's happening. So we have this, there's two hexaflex models, as they're called, right? So we have first psychological rigidity, right? Let's just look at the part that that we're looking at. Experiential avoidance. Let me see if I can highlight something. I'm trying to see tools that WebEx has. I can point. Let me see if I can point. Yeah, okay, cool. I see that. So experiential avoidance. Remember we're talking about when we have an image that we don't like that image, we're going to have experiential avoidance. We're going to try to avoid it, okay? So that's what happens with our experience. We try to avoid it. We don't let it happen. And what does that creates? Psychological rigidity. What do we want? We don't want psychological rigidity. We want psychological flexibility. So in order to be psychologically flexible, it's important for us to utilize mindfulness and acceptance processes. For example, we have acceptance and we have diffusion. We have self-context. Right now, I know there's a lot of things going on, and I don't want to overwhelm you. So that's why we're choosing to stick to specific parts of what psychologically flexible. This kind of topic, I could be many topics, many sessions that I wish I had all the time. So I want to focus on acceptance and mindfulness, and that's what it does. Acceptance and mindfulness lets us be more psychologically flexible. So objective 2 is to provide acceptance and commitment therapy techniques that increase psychological flexibility in Latinx individuals who are HIV positive. That's what we're talking about, ACT, right? Now, before we get a little more into depth, I want to know why we're talking about HIV and Hispanics and Latinos or Latinx. I know here the CDC doesn't recognize the term Latinx, but it's something that we're pushing. It was more of a social media construct that it was being pushed, but we really want to make sure that we are addressing that. And Latinos is only for Latino men or Latino women that are heterosexual, cisgender. So Latinx encompasses the whole LGBTQ community, and that's something that we're pushing as well. It hasn't yet gone through, the certain approvals of how it goes. But basically, what I want to make sure that we understand is that HIV in the Latinx community is very prevalent. So 26% out of 40,324 HIV diagnoses in the U.S. and 6 dependent areas in 2016, that's the latest stats we have, were among Hispanics and Latinos. Out of them, 22 were Latino men, and 3% only were women and Latinas. So it's very prevalent. HIV is very prevalent into the Latinx community. And we have another stat is that by at the end of 2015, there was an estimated 2,200, 252,400. Sorry for my bad math. Hispanics, Latinos had HIV, which 5 in 6 knew that they had the virus. So it's very prevalent, and HIV is very prevalent in the Hispanic community. So this is something that I would like for us to be mindful that mindfulness that's worked with many populations. The Latinx community is one because as, if I have any Latinos here, Latinx members, we know that we are very, at least I am, and a lot of my wife is Cuban. She's very, we express ourselves in many ways. So mindfulness itself lets us be present on the current moment and being mindful of our emotions and thoughts. So I think it's very relevant to the Latinx community. Now, this part I'm not going to spend too much on it. I just want to understand. I want us to understand before I put a video. Self as content. We are beings that we are looking at our experiences. So when we put, let me read you what I have here. You as the object of a summary, verbal categorizations, and evaluation. So for example, I am old, I am anxious, I am kind, I am mean, I am unlovable, I am sweet, and I am beautiful. Those are you putting yourself, you're conceptualizing yourself to a content, to an anxiety, to being kind, to being lovable, which what we're trying to do is to go the other way. We're trying to say that we are self as context. What is self as context? A transcendent sense of self, which is a consistent perspective from which to observe and accept all changing experiences, which is called also the observing self. That's what mindfulness is doing. It's just helping us to become the observing self. And that's what I want to put a little video that I transcribed from psychologist Russ Harris, and I did a little transcription on it. Let me see if I can able to put the video. Give me 1 second. Vanetta, can you assist me? I'm trying to find the video that was uploaded. I'm not able to look at it in here. If not, it's okay. I just want to see if we're able to put it. No? Yes? It should be there. It should be there. Has anybody seen a video? I'm not. Okay. Well, I'll make sure that it's there on the part 2. So if you want to see the video, make sure you come back in part 2. What the video was showing is, self as context is something that I'm trying to push. Right? We're not just beings living our life according to what our thoughts are saying, to what our mind is saying, to what our emotions depict of a current experience. We are beings that we observe our current experience. We are beings that we observe what's going on in our experience. So that's what the video was about, and it was including a metaphor, which I'll make sure that on part 2, I'll come back to it and I'll express it. Okay, I've been talking a lot, so I want to take this next few minutes that we have to do a practical experience exercise, and I want to make sure that this is something that I was taught when I was in my graduate program. You cannot expect a person to go somewhere that you haven't gone yourself. What I'm saying is, remember, mindfulness is something that we use as clinicians, but it's something that we can help clients, whether you're a case manager, whether you're a doctor, whether you're a physical therapist, whether you're a nurse, because if you're seeing that that person is having emotionally distressful situation, they're emotionally distressed, and they're going a million miles an hour, or they're just in a state of depression. This is something that you can help them just by maybe giving this. I mean, I can make this available for everybody to kind of get it, but I believe that mindfulness is something that you have to practice. You cannot just talk about it, and you can talk about it, discuss it, but if you don't practice this, there's not really a good way. So I want to take the next 3 minutes, and I'm just going to give you a little instruction, and it's up to you. It's our choice, but I would like for us to participate in this exercise. So, because there are so many things to be mindful of, and this practice is not easy to develop, it isn't. I want us to start out small. So, I want you to begin by having to track your thoughts alongside a single dimension in time. So, when thoughts and feelings or body sensations arise, they tend to be associated with a certain time period of your life. So, some may lie in the past, some may lie in the present, and some may lie in the future. Even fantasies that have no basis in reality at all are generally associated with a particular time frame. So to see this more clearly, I would like for you to take the next, let's do 2 minutes. I wanted to do four. Let's do 2 minutes and track where in time your thoughts lie. So I want us to take a moment to center ourselves. So if you're, I understand if you're with a lot of group of people, you may not want to do this, but whoever is willing and able, I would like us to breathe deeply from our abdomen a few times. Just a few deep breaths. It's lunchtime for many of us. When you're relaxed, just let your mind wander at its will and watch what comes up. So while doing this, I have this slide. I would like for you to put your finger on the time below. So as your thoughts and feelings arise, slide your finger to the point on the timeline that the thought or feeling corresponds to. Now, you will notice that there are 5 points on the timeline: distant past, recent past, present, close future, and distant future. You can choose any of these points for any thought that arises. However, know that this is a continuum, and if there's a point in the middle that makes more sense, feel free to place your fingers on that point instead. Try to be accurate about what's happening without judging what comes up. Okay, just watch it and note where in the time the thought, the feeling, or sensation lies. Okay, so now take the next 3 minutes, 2 minutes, let your mind go and track your thoughts in time. Whatever experience arises, just try to track it in the distant past, recent past, present, close future, or distant future. If any judgment comes in or your mind wanders, try as much as possible to stay on the present moment. I see here, and I would like us to, I want to make sure that we are inclusive of everybody's experiences. And so I want to stop this exercise just to, right now, we got a good minute. Miss Sophia Stewart Jenkins, I would like to share what you posted. It says, a distance one that brought back a hectic lifestyle that caused me into anxiety mode and crying uncontrollable. Thank you for sharing that, Sophia. And that's an experience that many of us have, anxiety. We have a thought, and this is just being mindful of what's going on in our life. And Rachel says, this is great, keep us from getting stuck in lies we believe ourselves. Yeah, because when we buy into these thoughts that we may have, that's when we get fused in our thoughts. As of now, I have more content, but I want to leave that for part 2. I appreciate so much the time that you're giving me. I would like to see if there's any questions. We only have 1 minute, but I would like to see if there's any remaining questions that may arise. So, cool.
Well, Shelley has a question. How can I help out with newly diagnosed to start an ACT process?
An ACT process. So there's many books, and I have references here. This is part of my experience as well. For example, I'm going to put the references. This is a great book. There's 3 books I put here. Accession to Commitment Therapy, The Process of Mindful Change. It's a guide. Remember, my ACT is ACT in itself is a module. It's a treatment modality. So it works with anything, with any kind of therapy that you may already be doing. So, and if you have any more questions, I would love to answer them. As of now, we're short in time, but I thank you so much for coming, and I'm going to pass the mic to my host, Benada.
Thank you, Leo, for today's presentation. At this time, we would like to open the floor for once more for any additional questions or comments. Please type them into your chat box or raise your hand. Okay, with that, there are no more questions. So if we have any additional feedback you would like, please do send us an email. Please be reminded to complete the post evaluation. It will open up at the conclusion of this event. And just in case you missed that, you will also receive an email with the evaluation link. Particularly, we would like ideas for additional trainings, events, and topics. Also, please be reminded once again that those of you who are seeking continued education credits that you must attend Part 1 and Part 2 of this training. Part 2 training is October 29th at 12 noon. Again, it's October 29th at 12 noon. Thank you for joining us today and have a great day.